And, Jennifer, thank you for this opportunity. I want to thank you and Aparo for the opportunity to be here today to share with you some information, hopefully that you'll find, I'm sure you've heard the term returning in the new normal. And I know I'm working with a lot of clients on their return to work. So as we prepare for that, I'm also certain that everyone here has been inundated with emails telling what you need to do to prepare to return your employees to the workplace. Well, this presentation, if you will, is going to be a fairly high-level overview of some important aspects, and then certainly we can dig down into the weeds as needed with questions. I would encourage you, if you do have questions, to please use the chat or the question in the Q&A section to submit those. And Jennifer, if you'll help me kind of watch for those, if I miss something and we need to address that, that would be great. I really appreciate that. And again, while this is, sort of a high-level overview, as I mentioned, my hope is that maybe you walk away with one or two key points that you find helpful. And of course, here's my typical disclaimer, okay? This is not legal advice or even tax advice in any way, but it's really based upon the experience and all the research that I've been doing. And certainly, probably like you, we're on a number of webinars that continue to take place throughout the organization. So here, as we prepare for the presentation, here's kind of really where we're going to. We're really looking at, preparing to ask our employees to come back. That's what we're looking for. What does it mean? We want you to come back. We want you to come back to the office even, as a matter of fact. That's what we're pressing here. So, it might not mean and might not look the same as it was in the past, if you will, but hopefully, you'll come back to a new environment that's just as engaging as it was beforehand. So here's what we're going to cover. We're going to talk a little bit about the materials and topics, but remember, this is only as good as today. It's only as current as today, because I don't know about you, but we've seen this change rapidly over the last couple of months. So things are changing constantly, including, if you think about it, I don't know how many of your organizations might have gotten the PPP or the Paycheck Protection Program, but just think about how that has changed and continues to change rapidly every day, about the repayment, the forgiveness, all this. So things are changing as we're learning more as we go along. But for now, this is current as of today. And really, during our short time together, we're going to touch on some key topics, some key points, if you will, including OSHA. And we're going to talk a little bit about that next. Policies, procedures, would like to touch on those from a high-level overview. And then preparing to return to office. What does that mean? And at the end of today's presentation, I've also got some links to available resources. And as I understand from Jennifer, we will be distributing a copy of today's presentation to everybody that's in attendance.
Yes,
so
we'll make it available.
Getting started with that, the important steps for preparing in the office and reopening your workplace. That's what we're looking to do. So how do we reopen our workplace? Well, one of the key things we got to keep in mind as you're preparing to reopen your workplace is really the general duty clause. We're just going to touch on OSHA real quick. As you know, the general duty clause applies to every employer, and that means that you have to furnish your employees with an place of employment that are free from recognized hazards that can cause death or serious physical harm. And so if you look at it from an OSHA standpoint, they basically identified that this pandemic is a recognized hazard in the workplace that can cause serious physical harm to your employees. Now, again, you have to follow all the rules and regulations that are applied under OSHA. But here was the important aspect about this for me, is that there have been some recent changes in what they call the employer having to do a reasonable analysis to determine if employees contract COVID-19 in the work environment. And if so, there's steps you're going to have to take to record and report that information. And while this webinar is not about that aspect of OSHA and the recording and reporting, it's important to keep in mind as you're preparing to reopen your workplace, what are you doing to prevent these potential hazards from occurring in the workplace? Now, here's a great example of a flow chart that was developed by a law firm called Kahn, Michael, and Carey. And there's a small firm that's got offices spread out around the country. And while, again, this is no plug for this particular law firm, I thought it was very helpful overview. It's sort of a yes-no flow chart. If this happens, you go in this direction. If it's a no, it's not recordable. So this is talking about record keeping. They also have the full steps about what's required record keeping, what's required, what is recordable, and then some additional information. So we'll provide a link to their website so that you can go and get them. But as you return to prepare employees to the workplace, how about we start out with a little bit of participation from the audience here. And this is where, Jennifer, I can get your help here. Would like to sort of start out with a pop quiz here. Actually, if you would, this is from a Count on Me NC website that's available to employers, to businesses, and it provides training for businesses on COVID-19. And while Count on Me NC is primarily focused in retail and food service industry, it does have a section for general business. Now, this pop quiz is an example of a check-in that's asked at the end of each chapter, or each section that you go through. So I'd encourage you to check it out. But I'm curious to know. So it looks like everybody's had a chance to vote. Let's see here. We'll give it just a few more.
About half of the audience has voted so far.
All right. So, and what's good about this, the Count on Me NC website allows you to, this is just, as I said, an example of a check-in from their website for the sections that you cover. And what you can do is take this class, and it helps prepare you, but you can register your business with countonmenc.com. You can get window stickers, certificates to post. You can get your company listed with them that you've gone through this training. And actually, I found it pretty helpful, at least from the general business standpoint, to make sure I'm thinking about all the different aspects of it. And we'll talk a little bit later about, having employees complete health screens. So how are we looking there?
So we had about 75% of the audience respond, and this is how it is shaking out. Can you see that?
Yep. So we got some that would have passed, and some that would have to go back and revisit it. And we'll talk about that again. It is false. You are allowed to ask your employees, and you're encouraged to ask your employees to complete a health screening at the beginning of every shift. So just to let you know, we'll talk a little bit about that. Okay. Moving on. I think we can clear that. Off the screen. Let me close that. Okay. So what do we need to do? Well, one of the things that I want to make sure that we do here is take a holistic approach to how we look at our new normal in the workplace. And if you haven't done that, as you're preparing to return in the workplace, well, what's the impact it's going to have on your current policies and procedures that are in the workplace? So some of the things you want to look at from a holistic standpoint are going to be making sure that you've developed an infectious disease control policy, and that would include COVID-19. A lot of times we say, do you have a COVID-19 policy? But what you're really looking for is an infectious disease policy. And what does that mean to your environment and your organization? Some of the other policies you're potentially going to want to look at have to do with conduct in the workplace. What are the behaviors that you're expecting? Whether it's regards to handshake, how are you encouraging people to respect others' personal space in the workplace? Are you practicing social distancing? What are you requiring? Will it be masks being required to be worn while you're in the office? And we'll talk a little bit about that in the next slide. But some of the other policies that companies are finding that they need to struggle with from the stay-at-home orders and people working from home has to do with work performance. What expectations in your policies have you communicated with employees about response times or deliverables that are expected from an employee while they are working from home? So as you're preparing, you're going to have some employees back in the office, some working from home. What are the expectations for response times, deliverables? How are they going to assist others' support? What about your policies on business travel? Have those been updated now within the organization to determine what is essential and non-essential travel? And again, these are things like who approves travel now within the work environment. Do you have things with business travel that addresses how many employees can travel together in the same vehicle if you have employees driving around the city? Do you have a policy on handling meetings, whether they're virtual meetings? And when we say virtual meetings, think about, I don't know about you, but I've been on several several of the video conferences now too, where you probably see things in the background that you were surprised and weren't expecting. How have you trained and educated your employees into what to expect if they're on a video conference for work at that point in time, or even how they're engaging with either donors or supplies or supporters, or even clients that you might be serving as a nonprofit? The other policies you want to think about, have you even addressed your salary or compensation structure? How are people recording their time? How are they reporting it? How are they getting compensated? Have you had to take any reductions in salaries, and what does that mean, and how's that going to be addressed? But what do you have documented to give yourself some type of outlining guidance to addressing these type of topics? Further, think about areas such as common areas. What are your policies with regards to that? People gathering together in common areas, whether it's break rooms, whether it's in lobbies as people arrive at your facility, visitors in the workplace, how are common areas being utilized? What is your policy on meals and rest breaks now at this point? We know that a lot of companies, you might have a lunchroom that's being restricted to being used, and employees are being encouraged to have meals at their desk or outside the workplace. I know of a client that has even gone so far as they've closed their common, if you will, refrigerator in the break room that employees normally used. And what is happening is at this point, they've decided they're providing all employees with like the little cold boxes or ice boxes that they can use to carry their lunch in and out for them to utilize. So they're taking the extra step. While it's an inconvenience not to have the refrigerator available, it's also a protection against them from COVID-19. What's your policy on, excuse me, flexible work arrangements? Have you thought about that? I mean, because there's going to be some employees potentially that are going to want to work from home or need to work from home, even following your return to the office aspect of it. So how are you applying that? How are you addressing that and supporting your employees and being flexible for whatever reason it may be? The other area of policies that you might think about have to do with your IT and technology in the workplace. What guidelines have you established for employees working from home, their connectivity, their availability? What kind of software can they use, not use? How do they access your system? Think about the remote requirements when people are on working virtually in the office. Another one is for a lot of organizations that are small, what are you doing about sick days? Are you providing flexibility to your employees by providing them either sick days, how many, what are your reporting requirements for that? And I'm talking about sick days for your organization in general, not just the emergency paid sick leave that, as you remember, even though a lot of us have experienced it in the last 2 months under the stay-at-home orders, this emergency paid sick leave, which provides for paid sick leave up to 10 days and also an expanded FMLA leave coverage, continues through December 31st of this year. So employees who might not have had a need for it in the beginning might find themselves needing that benefit going forward. So what are you doing to prepare for that? And the other thing about providing for leaves is thinking about your policy for coverage should there be another outbreak. And we're going to talk about that a little more in the next slide also. What that means to us. So these are just a few of the policies. Go ahead, Jennifer.
Excuse me, Keith, I was going to say, but I just wanted to ask you a question before you go to the next slide.
Okay, go ahead.
So I was wondering about as businesses define these policies for each of their individual workspaces, are there general guidelines already out there that people can use? For example, I look at number 1, infectious disease policy. Okay, are there existing infectious disease policies that would apply to the COVID-19 virus, or do we have to extend that beyond that? How do we know whether we can share refrigeration or not? Like, where do we go to understand the benchmarks of what's available versus what we feel compelled to do to be even safer?
Well, that's a great question, Jennifer, by the way, but I will say a couple of things about that. One is it's all going to be unique to your work environment to begin with, but there are a number of examples that employers can find even on the internet. I mean, there's been a lot of law firms that have put out general guidelines. OSHA's put out some general guidelines. I have some templates. If somebody would like to reach out to me, feel free to share, that have been put together, and I've been given permission to share. So if somebody's looking for a general template, it walks you through asking some of the questions. And again, as you walk through those, sort of those sections, it'll challenge you to sort of say, what do I need to consider in my work environment for our employees? Because each work environment is going to be a little different. But there'll be some general guidelines, and mainly through OSHA and the CDC. Again, at the back of, at the end of the presentation, I do have links to some resources you can access that might be helpful in that area. Does that help?
It does. So what I'm taking away from this is that there are general guidelines, there's latitude based on what individual business circumstances are.
Yeah, I think you have to sort of tailor it. It all does need to be tailored to your particular location, whether it's from states. States have different requirements, OSHA federal requirements. So you'll need to kind of look at that and what your industry is like. What kind of industry are you working in?
And then one other question.
Yep.
How do we go about, to whom would we go to for a conversation to sort of look at what we've put together with a critical eye to say, yes, I think you've addressed what needs to be addressed in your industry, or hey, you might want to think about this or that. Where do people go to kind of get that advice?
Okay, well, I'd have to say right off the bat, certainly if you have outside counsel that's available to your organization, I would encourage you to run that by your outside counsel to get legal advice, if you would. But on the flip side, there's a lot of consultants out there, including myself, that are happy to take a first pass at it for you, to sort of take it from a critical eye to say, have you addressed these things, and look at that and sort of assess what you're putting together. Because it's more than just writing this policy. That's the first step. But now, once you've written it, how's it going to be implemented, and how's it going to be communicated to your employees? So there's steps you got to consider as you go through this. But certainly there's I'm sure a number of consultants out there, myself included, who'd be happy to assist with looking at that. And that's not trying to make a plug. That wasn't the reason for saying that. But I think it's a great question. But it's either through your outside counsel or somebody who is dealing with this as a third party that could give you a critical review.
Thank you.
Yeah, now, speaking of that, so my point in this is that under our new normal, we're just looking for taking a holistic approach and putting something, a step together, a procedure, a requirement that we realize it has multiple impacts in our organization, not just on one policy, but on another. So how do we go back and assess that? So I'm just encouraging you to make sure you assess this from all of your policies. So as we look to reopen, what are some of the points we need to consider? Well, hopefully you've put together a sort of cross-functional team. Don't do this from a vacuum or in the ivory tower. Get a cross-section of your employees put together as a team to assess what needs to be done and what should be included in your health and safety plan. And this could be as a response to COVID-19. And some of the things you might think about would be, in our plan, some of the aspects we're going to talk about: physical layout, the resources for employees, but, what are the expectations of behaviors in the workplace? And also, what is your plan? Does it include for contact tracking assessment? So what do you do with an employee who shows up positive at work? How do you go back and assess that? How do you communicate that to other employees who might have been in the vicinity of that person? So, you have to make sure that's all part of your plan also. But before you can come back to work, you're going to also want to do a building or workplace assessment. And a lot of that means, number one, how long has your building been vacant and unused at this point in time? There's a couple of things about, what that means. It could mean from a plumbing system, AC systems, what needs to be serviced prior to employees turning in. It could be how you conducted a deep cleaning of the facility, whether that's the Clorox type deep cleaning or whether it's the electrostatic cleaning that a lot of organizations are now starting to put into place. So you're going to want to make sure that prior to employees returning, you've gone through, you've assessed the building, you've conducted a deep clean of the building to come back in. You've identified those high exposure areas that include high touch areas, whether it's elevators, doorknobs, common countertops that are used on a regular basis. How have you identified those areas that are critical to employees in the workplace? What about the physical layout of the workplace? You're going to want to make sure you walk through the steps of your plan to look at signage in the building about you know, advising people not to come in if they're sick. And there's a ton of examples of those type placards you can put on your door or right at your entrance of your workplace to remind people not to come in if they've experienced these symptoms. Other little steps that companies are taking, if you have multiple stairwells in your building because you're multiple floors, organizations have gone to develop one stairwell is only for going up and the other stairwell is all for going down in the normal course of business. Use of elevators, restricting how many people can be on an elevator at once, putting hand sanitizer at the buttons there in the with the elevators, so people are constantly using that. What about your social distancing? Are you encouraging social distancing in the workplace by making sure you're taking chairs out of common areas so that people are maintaining a 6-foot separation, if you will? Same thing in conference rooms. We've seen a lot of clients now that have taken their conference rooms that might have normally had, you know, 12 chairs in there, the big conference table, they're taking 6 of them out now. So they are forcing that social distancing in the workplace. And what this means is for you and your team to go back and assess your own environment. What are our meeting rooms like? How are we encouraging and enforcing social distancing at this point? We know that a lot of organizations are also putting in some partitions between workstations. And whether those plexiglass walls that are put up above the workstations, because a lot of people in cubicles at this point, could be sneeze guards. We've seen it all around. So people are pivoting to be able to protect their employees from at least give them a sense of safety and security in that aspect. So those are some of the steps from a physical layout. Is your building accessible to do that? Also, do you have the ability to let employees physically use the outside space of your organization? Maybe you have a patio that you haven't used in the past. It hasn't been encouraged, but now you'd be encouraged to assess how that could be utilized in your workplace. The other thing that we've heard a lot about lately is assess the airflow in your facility. At that point, we've noticed a lot of people can get sick based upon the airflow. Can you upgrade that somehow to improve the airflow, increase the air filtration system in your work site? It might even be as there are certain portable systems that you can buy and put in the workplace. So have you gone through to assess what's the right thing to do here, and how do we station people away from airflow sections so that it doesn't potentially put them at higher risk of contacting COVID if somebody is positive. Also, what kind of resources are you going to provide for your employees? Now, when we talk about providing employees with PPE or personal protective equipment, the thing to keep in mind when you provide employees with that is OSHA requires that you provide them some type of training on the proper use of that equipment. And again, it can be as simple as just a PowerPoint presentation or a handout, but you're educating them on the proper use of that PPP. So some of the other things you can provide to employees in the workplaces are coming back is hand sanitizer, disposable mask, maybe it's gloves that are needed at that point in time. I know that I've got a client that they have provided little kits for their employees to pick up every week when they come to work. It's a week's worth of mask and hand sanitizer for them to use while they're in the office building at that point in time. I have another client that requires, the procedures are outlined that as soon as an employee arrives at work, the first thing they're required to do is go wash their hands. So they come in the building, they've got to go wash their hands before they can start engaging or doing anything else. Providing employees disinfectant and cleaning wipes so that when they use some of the common items, the printer or some other fax machine or some other item within the workplace that's common, that they're required to wipe it down. Similar to like when you go to a fitness center, fitness club, you're going to have to wipe down the equipment after you utilize that. So same thing. But also think about beyond that, some of the additional resources. We know that as our employees have been stressed at staying at home. While we think it's a great thing, that creates its own amount of mental issues, if you will, and stress that's there. So are we encouraging our employees that we provide them with an EAP program that's available to them, an employee assistance program? What are we doing to encourage the utilization of our health benefits that they have available to them? So we want to encourage that and communicate and remind them. The other thing we're going to want to do is think about maybe replacing, we talked about common areas and restricting that. We used to have a lot of ceramic cups around that we'd have for coffee and things like that. Well, maybe we're going to start providing plastic utensils for employees to use when they need to, disposable cups, things like that. Think in terms of also, we talk about the physical aspect of the workplace. Where can we go touchless? Can we have touchless trash bins or things like that? So as you're putting together your plan, you have to sort of think again, this is a holistic approach. How's the employee going to interact in our new work environment at this point? So once you've kind of gone through these points, you've developed your steps for reopening, and whether that's in phases or all at once, certainly there's restrictions at the state. Think about how you communicate with the employee. There's several touch points with employees that you can consider employee communication. That's first just the return to work notification. A lot of employees, how do you communicate with them? It's not like on Friday calling them up and saying, hey, you got to be in the office on Monday. Think through your timing issue. How much advance notice do you give them to prepare to return? They've got things they've got to take care of. But also think about doing this in a phased-in approach, similar to how states are reopening. Phase 1, phase 2, how are you going to do that? A lot of organizations are communicating with employees. It's on a voluntary return basis. And a lot of that's also to help you control the amount of employees that are in the work environment as you build back up to full capacity at this point. And that could be staggering shifts. Employees who want to come in have to make sure they give you advance notice, communicate with that, who's going to be in and when. You could have employees working Monday, Wednesday, Friday, 1 week, and Tuesday, Thursday, the other week in the office, and the other days they work remotely at home. And then the second group shifts. They work Tuesday, Thursday the first week, and then Monday, Wednesday, Friday the second week. So that way you've at least cut your workforce in half and limit the exposure and practicing the social distancing in the workplace. It could also just mean staggering start and stop time. So maybe somebody comes in at 7 instead of 8 or 8:30, and they go home earlier while the other group comes in later and they stay a little later. So the key here is being flexible with your employees. So how do you develop that return to work notification and what you're going to require of them? The other thing, and I'm going to show you an example here in a little bit, but what is being done and what has been done. You need to communicate that to employees to help put them at ease, to answer their questions that they may have, because some employees will have a hesitation and a fear of returning to work. So how can you help ease those fears to say what you've done and what's being done? And then you need to communicate specifically in your plan what's expected of employees. So they need to know what's expected of them and their behaviors in the workplace and how they operate. Here's a topic that has really surfaced over the last couple of weeks, and that has to do with your vacation and PTO policies. You need to communicate with employees about that, because a lot of companies realize that employees have not been able to utilize scheduled vacation this first half of the year like they had probably planned at this point. But what do you do about that? How does it impact your policy? And what are you going to do? Think about being flexible for the employees. What are the potential adjustments that you need to make? How do you communicate those to your employees? And what exceptions are going to be made? For example, I know a client that has determined they have a use it or lose it in North Carolina, which is accessible, and their policy states that. They don't want to deviate from that, so they've told their employees that they have up until September 15th to utilize at least half of their eligible vacation. So by September 15th, they have to use half of it. And by the end of the year, they have to use the remaining balance of their PTO time. And then again, if they're unable to do that, they lose it. So they're really encouraging and forcing people to think about scheduling time away from work to hopefully, and you want to encourage them to do that. So something to think about, if you're going to have exceptions, then talk about what those exceptions look like that are based upon, business needs. One could be that you're allowed to carry over 5 days to be used in the first quarter of the next year. So just think about how this has impacted the employees who've been unable to utilize their vacation. You need to communicate that with employees up front so that they know. Also consider putting together some frequently asked questions for employees in your communication piece. You're going to want to anticipate what questions might come up from employees, and how do you address those? What would you like for them to know? Now, there's several different resources out there that can give you examples about that. For those of you who are SHRM members, you've probably seen some material come across through SHRM on examples of how to communicate with employees. And I'm going to give you an example. We're not going to go through each of the slides, but here is a customizable PowerPoint presentation that's already been put together by Sherm that you just tweak and customize for your organization. And it's really a return to work guide for employees. And what does it do? Well, the first thing, it has a welcome back slide that's really positive and encouraging about welcoming back your employees to the workplace. The next thing it touches on is it touches on, you know, what are we doing? So it talks a little bit about what are you doing in the workplace? What have we done in the work environment for employees, so they understand what has been done before they're even coming back to work. The presentation goes on to also talk about, you know, what you can do, meaning what can the employee do at this point to help prevent COVID-19 from spreading in the workplace. So these are steps that are already put out there, the templates out there, you tweak it for your information, and it might even end with it has one of the slides that you can see, you know, what's changed at work. Now, what I will say, and I'm going to go back just for a second, is that, and when you look at this slide and we talk about what you can do, the template also goes on to address some other frequently asked questions that addresses topics like working from home and your safety in the workplace, communicating concerns, the issue of reduced office capacity, planning and scheduling each work week, medical risk assessments, and what happens if you're feeling sick in the workplace. What are you requiring employees to do? The requirement addressing mask and meetings, and then also communicate up front and be, you know, let employees know how you're handling any COVID-19 positive cases at work if something were to show up. So again, it's a great template, and for those of you who are SHRM members, I would encourage you to go out and look at that and figure out how you can tweak that to communicate with your employees. Now, I know, as I mentioned, this was all high level. Here's kind of a list of resources that I mentioned earlier. The CDC has a great resource for businesses and employees to look at what is required of them. OSHA, we talked a little bit about COVID-19. They have a great section on there for resource of information about COVID-19, including the guidance for recording cases in the workplace. I mentioned SHRM, and just as with SHRM, they release a lot of articles, but some of the materials may require membership. So if you know somebody who's a member, I'd encourage you to get some of that information. Great material put together. North Carolina and South Carolina both have hubs, if you will, for addressing COVID-19 from an employer standpoint. There's the link to Count on Me NC, which I think is a great resource. And there's an article by, again, I'm not promoting any of these law firms, Warden Smith has an article out there, Returning to Work in a Pandemic, that really walks through some information that is important for, I think, employers to know. So as we sort of wind down this overview, if you will, high level, it's really thinking about the steps you got to take. What's the steps you have to take to reopen your work environment, understanding the federal, state, and local requirements that impact you and your industry. Talk to and communicate directly with your employees, engage them as to how this impacts them in the work environment. Create your reopening plan with a cross-functional team, and then plan. This is going to be key. We've all heard it, and I think we need to be prepared. Plan for more closures. If there's a second wave of an outbreak that happens in the fall as being anticipated, how are you prepared this time to address that with your employees in the workplace? So with that, I hope that, you know, as I mentioned, that this is just a quick overview that has been helpful. I would open it up to questions. Jennifer, I hope that sort of concludes my overview. So here's my contact if you need anything.
I wonder if you'd go back to the slide right before communications.
Let's get back. We can go back.
Right there.
That one.
Yes. So you gave us, you know, the list of resources on the last slide. And what I wonder, as I was looking at this slide, a couple of things occurred to me. How do I know what constitutes a deep clean? What does that mean? Are there guidelines like in the resources, for example, for that?
Yes. As a matter of fact, the CDC provides you some very specific guidelines about what a deep clean involves, all the different surfaces. Now, you'll also learn on there as you go through that if your facility has been closed for a long time with no traffic, no activity, nobody in there, the virus can only live for so long. So they're going to tell you, but as far as a deep clean, they will tell you get out your Clorox wipes, kind of disinfectants. You know, how do you touch every surface? How do you change the air filters, the airflow? You know, how do you go through and make sure everything's been, especially, you know, when you got carpets in the workplace, How do you deep clean those? How do you sanitize the whole area? But the CDC is a great resource for explaining what that means.
Perfect. And then I think you answered this question, but let me just double check. The other thing that caught my attention was contact tracking. It sounds like you said there's a resource that guides us on how that happens if an employee tests positive. Correct?
Yeah, there are some guidelines out there that will tell you what you can, how do you ask employees? If an employee comes to you and says, I've tested positive for COVID-19, you have the right to go through an exercise to ask them questions, to say, who have you come in contact with? Who have you worked closely with in work environments, from an employee, from a customer standpoint, client standpoint, so that we can notify them. And again, there's privacy issues with that employee. You don't go out and say, hey, Mary B is positive, so you need to know this. You have to communicate with your employees that someone is tested positive, that we believe you've come in contact with, encourage you to go get tested and all that. But so what you're doing is sort of engaging the employee who might have tested positive so that you're aware and can put other people on notice. Now, we've heard a lot about, there's a lot of new technology out there now that can tell you who you're, from a contact tracking standpoint, where you've gone, who you've been with, and things of that nature. And this sort of goes into when we talk about contact tracking, so we can advise people, whether you're talking with your county health department about, you've got somebody who's positive and how many individuals outside the organization were exposed to this. Is one aspect of it, but on your contact tracking, it's just important to know who your employees come in contact with for the purpose of preventing, hopefully making them aware of it, but also that's going to help you determine where did the employee potentially contract COVID-19. And that's back to the OSHA issue of, is it a recordable example for your OSHA log?
Yeah, I think what I was wondering about there is, are there guidelines for due diligence, right? Because we hear a lot in the news about contact tracking programs and how they're going to ramp up and it's going to be very sophisticated. But it seems like we would be doing something different in our space. And I just wanted to make sure that there were some guidelines out there to sort of guide us in that initiative so that we're doing, due diligence.
Yeah, and I think as you put together those guidelines, there's reference points out there, again, available, whether it's through the CDC or whether it's through OSHA. But I would also encourage you to run it by, some third parties to make sure that this makes sense, whether it's, are we doing the right things and asking the right questions.
Gotcha. And then also, I was looking at the last bolded item on this slide about PPE training, and you had mentioned that there was the SHRM PowerPoint that you showed. So if you're a member, you can get access to that. But are there other examples of sort of that kind of training out there that we could just get at and sort of repurpose for ourselves rather than having to create from the ground up?
There is, and again, some of it's free. I think OSHA provides you some guidelines on PPE training, and communication. And again, I mean, not that these sites are always the easiest to navigate, but a lot of that information is out there. And there's different organizations who specialize in safety that have some guidelines, some things to help you with. And a lot of times your PPE provider, getting mixed up with a Paycheck Protection Program. Your PPE provider will also have resources and information. So whether you're getting your materials from, a lot of times they can provide you with some guidelines, proper utilization and use of the items.
Perfect.
All right. What else?
So those were the questions that jumped up across my radar screen, and I'm not seeing any questions come in on chat. Well, we just had something come in on Q&A, and the question is this: if you are a client-facing agency, are there resources to assist with due diligence for contact tracking? Which is, so that tells me, let's answer that again.
Can you ask the question one more time?
Sure. If you're a client-facing agency, right? So are there resources to help determine what is due diligence relative to contact tracking?
I guess I'd have to understand the question a little better. The due diligence, contact tracking, again, I think I'm thinking about due diligence. I'm thinking about this from a practical standpoint. If you mean I, as the employee, test positive, and I've had interaction with my client-facing organizations, then at that point, how do I communicate back with that client? And what do I communicate to them to make them aware that they've been exposed to through engagement with our employees, without specifically naming anybody? The other thing is if my employee contracts COVID-19, and how do we go back and determine, notifying that person, say, we're not certain, if it came from your environment or ours. I mean, I think that's part of the due diligence, the communication between those who may be impacted or impacted by the potential positive case.
Let me give our attendee. I've opened up the mic. If the attendee who posed that question would like to go a little further for the presentation.
Thank you, Jennifer. No, the reason I asked the question is, we are a client-facing agency, but we also work with a lot of volunteers. So I understand the notion of the due diligence piece. I guess my question was more along the lines of, and maybe I didn't articulate it correctly, so I apologize for that up front, is that we're looking at a process where we have everyone who enters our establishment do temperature checks, right? And so we're logging that stuff. And so I think I understood you to say that it's important to keep track of who's in your space at any given point in time. So if someone were to test positive, that you're able to do the proper due diligence by making people aware and things of that nature. Is that correct? Did I understand you correctly there?
I think that the part that sort of tripped me a little bit, keeping track of who's in our facility. I mean, certainly a lot of companies already have visitor logs and things of that nature. So who comes into our facility? Hopefully we're communicating up front, sort of, you're not authorized to enter the building if you exhibit these, symptoms and all that other stuff, to try and encourage them not to come in. But, from a tracking standpoint, contact tracking, it's like if our employee does contract COVID-19, we want to know who we need to notify. So that's kind of, part of that due diligence, to say, who have you engaged with? Yeah, we might have had this person in the building, but we're not necessarily, you might not have been in the same area. So just because you were here, you were in a separate area of the facility, we don't have to notify you necessarily. Just because somebody in the back office that you would not have had any contact with, tested positive. So you do have to kind of limit the audience a little bit, think through who they're exposed to, and that's the people you would notify, not just everybody in general. So I don't know if that answered your question, but
no, that was very helpful. No, thank you so much.
Thank you for the question. So, thank you.
And so we've got another question here, Keith.
Okay.
The question is this: can an organization put policies in place regarding employee behavior outside of the workplace? In other words, how can you control when an employee outside of the workplace is not following social distancing recommendations, and then they come into the workplace after non-workplace activities? Where do we land on that?
Wow, that's a great question, by the way, because you think about that. There are certain steps you can put in place and certain policies you put in place that sort of expect or require your employees to notify you when they've maybe traveled to high-risk areas. That your policy is, if you travel to a high-risk area or engage in a high-risk activity, you're required to self-quarantine for 14 days. So there's certain policies you can do that. You put it in place, they have to self-quarantine for 14 days. Now you have to determine, what is your policy for that self-quarantine? Is it paid, unpaid? Do they have, the ability to utilize the emergency paid sick leave act? But remember, there's got to be certain steps that have to be followed in order for them to be eligible for that benefit. But are you going to make it paid, unpaid? Do they have to use PTO time? But yes, you can put policies in place that say, you're being notified. If you engage in one of these high-risk activities, then you're required to self-report and self-quarantine at that point. So now, how do you enforce that? You do have to be careful about, you're not telling them they can't do it. Now, you're not trying to control it at that point, but you want to make sure it's reasonable. You know, we don't want to just say, and this is, I'm thinking off the top of my head here, and as I said, none of this is legal advice, but, you know, we don't want to put a policy in place that says, hey, you know what? You went to your, you went to a gathering, maybe it was a religious gathering with everybody else that wasn't practicing social distancing. You can't do that. You know, we don't want to get involved in some of the protected activities of individuals that are out there. So again, it's got to be reasonable. It needs to be tested. Look at your policy, but you can put steps in place to tell the employee they have to self-report and self-quarantine if they engage in certain high-risk behaviors to protect, and you're trying to protect them and others in the workplace. The reason for it.
Yeah, it sounds like, I mean, there's a lot of personal responsibility, I think, that goes along with what we're talking about here. And we're asking people to be responsible in terms of how they interact in the workplace relative to what their non-workplace behaviors were. Yeah. And you know, that you practice consideration and that you're careful not to accidentally spread a virus that you didn't really mean to.
Which is true. And I think, you know, the more we do to encourage and educate our employees and provide them the resources they need, I think it certainly benefits all of us in the long run. Anything else?
I'm not seeing any other questions come in across chat or Q&A. So I'm going to take that as an indicator that we've provided information to help answer the questions for folks who joined us today. And what I'd like to remind our listening audience is that, you know, we'll provide this information to you within about 24 hours. You'll be able to have access to this deck along with the resources that Keith included for us. And certainly, you know, take advantage of any of that information. Also, Keith, I think your information is included as one of the last slides in there. So if anybody, you know, would like to follow up with Keith, please feel free to do so. If you have other questions that perhaps Aparo can help you with, why, we're certainly happy to do that. You certainly just let us know. With that, I'm going to, let's see, I think it just had a chat come in. Let me make sure we're not missing a question. It was a thank you. Everybody indicating that they appreciate what we presented today. And yeah, they're just thank yous coming in. And
well, I appreciate that. Thank you. I hope it's a lot of information. I hope it's helpful. I wish everybody certainly a safe return to work in the new normal as we're getting used to. And again, if there's anything I can do, please let me know.
Keith, we sure do appreciate your time today. Thank you so much.
My pleasure.
Yeah, I thank everybody for joining us. Have a look on our website within about a day for these resources, and please reach out if there's anything else we can do for you. And with that, I'll close our meeting. Thank you, everybody.
Take care. Bye-bye now.
Have a great day. Bye-bye.